get to a presentation. Give me 1 sec to just share my screen. And I'm going to move y'all around so that I can see y'all a little better. You should see the PowerPoint. Sarah, can I get a heads up? Yes?
Yes, we're good.
Awesome.
We can see the PowerPoint.
Beautiful. I'm going to pull up on my screen some way that I can see it myself too. There we go. All right. So I'm just going to go through this again, just sort of really quickly. Again, this was something pulled from last year with community director training, but I think it's important to ground us again in what in the world is residence life. I know that for a majority of you, you're not going to do this for your entire career. A healthy portion of you are not going to do this for your career. What I hope you do, though, is that you take a lot of the lessons that you have from here and apply that to whatever sort of field or career it is that you're going into. Every institution that I've been at, almost every sort of RA training or FA or HA kind of training that I've seen always talks about the celebrities who were once an RA at some point, who worked within housing and res life at some capacity. They were a part-time desk clerk, a student assistant, something like that. It's great to acknowledge those famous people who are like that. But more often than not, the student staff that we have here in the department go on and they are successful within the careers that they go into. It's great to know that folks like Scarlett Johansson, Hillary Clinton, and a bunch of other folks were famous for being RAs. But I'll actually tell you as well too, I'm not sure if even those people were RAs. I'm just making up names here to see if we're sort of paying attention. But there's a lot of famous folks who were RAs. It's great to acknowledge them. But I think what's even more important is acknowledging the fact that all of you are going to go into your careers, whatever those are, and you're going to take your lessons from here and share them there. So I'm just going to talk a little bit about what the live-in staff component looks like, why it's important within students being successful within the residence halls. And so to take it to a bigger lens, I do just want to sort of name the core components of housing and residence life, what those sort of really look like, all the things that go into how it is that folks live on campus. Gina gave like an organizational perspective, that it's not just the folks who are living and working in the residence halls, not just y'all, but that there's a whole bunch of other people who do things with residence life that fold in a whole bunch of other sort of components. I'm just kind of going through all those sorts of things, what that includes, so that you get a sense of how big of a deal it is that you work within this department. You may not feel it or see it all the time, but these are all the things that are part of housing and residence life here at UNT. It may only feel like the residential education residence life part, but it is also a whole lot more than that. Everyone sees that? It's a lot. We are in many ways a small town that is part of the larger city that is UNT. And I always say that anyone who works within student affairs and higher education, if you work within housing and residence life, you can be the president of a university pretty easily, I think, because of all the components that you have to sort of manage here that you see in front of you right now. And I hope for some of you that might be the pathway that you sort of look at. And even if it isn't, I think you can take these sorts of skills and to put them to whatever career it is that you kind of go into. All right. So why do we have staff live on campus? Why do we have y'all in the positions that we have y'all in? Why do we have community directors, assistant community directors, HAs, FAs? Why do those positions exist here within the residence halls, as opposed to having you live off campus and then come in and visit and then go back to your off-campus apartment? Well, there's a historical component to it, first of all. back in the day, and by that I really mean, you know, around the 1600s and even earlier than that, within the US at least, there used to be faculty that lived in the residence halls, that faculty living in was part of their job, that they were in charge of a house, and that for all intents and purposes, in the same way that the community directors are sort of the captains of the ship that is their residence hall, it was the faculty folks who lived in, they were the captains of their ship. And there is usually a pretty close connection between a specific major or academic college and the hall that folks lived in. So if you lived in this hall, that meant that you're a poli-sci major. If you lived in this hall, that meant you're in the liberal arts. That model kind of still exists, but definitely not to the degree that it did back in the day. The language that you probably still think of in some ways as you come to college, you're exposed to mass media, as you see movies about fraternities and sororities especially, is this language of house mothers, that basically that housing and res life takes the place of the parents once folks come to college. And that gave a lot of leeway to what universities could tell their students to do. That by default, universities were the parents of the students when they came to colleges and universities. Now, all this was, again, going from about the 1600s all the way through about the earliest 20th century. And then, quite honestly, World War II came along and changed a lot of that. A lot of veterans that were coming out of World War II and going off to college, those folks who then were sending their students, their children to colleges years afterwards as well too, kind of came from places in which they'd already grown up in many ways, and so the sort of in loco parentis perspective started to change within those about 20 or 30 years. And right now we're sort of in the middle ground of that, and I would say that's particularly true for where we are in navigating COVID-19, is that folks want us to say that you have to do this and that, and at the same time, folks want the opportunities to make their own decisions as well too. So it's a tricky middle ground that we're in right now. So again, why we have y'all in the residence halls is so that students, there's an opportunity for the university to know students in a more significant way, that y'all and the community directors can become known members of the community, and that we're likely to have an immediate response to things whenever stuff hits the fan, is that we can be right then and there responding to an incident. So that's why you are here. And again, there's a whole bunch of benefits related to that around safety, students feeling supported, retention, graduation, enrollment, job and personal satisfaction. All that is great. In terms of the university being successful. I try to look at it more so from the place of how successful are our students going to be by having y'all as the resources available for them to go to for help. How can you make sure that a student is being successful here at the university? The other things, enrollment, GPA, graduation, yeah, that's nice, but I want somebody to feel that they're successful. Success also for some folks doesn't always mean that they're going to be graduating from this institution, that this might not be the fit that they're looking for. But I want them to be successful no matter what it is that they go forward with, and how we can provide those opportunities for them is vastly important. All right, I'm looking at the screens. I haven't drawn too much of your attention away. Good. All right, so what do you do? Folks seen sort of memes like this before, images like this, what your parents think you do in terms of being RAs, FAs, HAs, probably the same thing in some ways. What your hall director, community director might think you do, what your residents think that you do, what your friends think you do, what I think I do, and then finally what I really do. All right, folks have seen memes like this before. This one felt the most positive, sadly, strangely, I'll name that. And yes, it's kind of all these things to some various truths. It is kind of all these things to some degree. But what you do especially for those of you who are new, is going to be talked about over the next couple of days. So that's going to be about going through job description, your expectations, the entirety of training, not just what you're receiving now in these next 2 weeks, but what you're going to receive through the entire academic year, the all staff meetings that we have for the semester, the training that you're going to receive in the spring, your staff meetings that you have within each of your individual communities, the extended training the first year RAs are going through. You're going to receive all of those what you do, the what and what you do during this entire academic year. And then naturally on the job as well too. I think I've told folks before, and I don't think I'm talking about it at this training, my first on-call experience as a community director was whenever the Red Sox beat the Yankees for the first time in 80-something years. And they broke the curse. And what happened on my university's campus at that time was that there was a celebratory riot. There was no protocol or policy for that written. It was an experience that I could only sort of learn on the job, and I feel much more prepared for a celebratory riot if it happens again, knock on wood that it doesn't. But there are only some things that you're going to learn on the job. I hope that is not one of those things you have to learn about. So the what you do is important, but also I want folks to sort of consider the how you do it. So part of that is going to be about the expectations that your CDs go through and that we will talk about as an entire RLA experience, that there are protocols and policies to follow, that there are some federal and state and local laws that we have to follow, lest we lose funding on some things or lest we get charged with fees as well too, that you're going to receive feedback from your supervisor, you're going to receive feedback around how you work as a leader, you're going to receive feedback from your peers, which I think is sometimes the most important of all this as well too. Supervising feedback, what that really should say is you're going to receive feedback from your residents. You should have time to self-reflect, and you also should be getting an evaluation at the end of each semester. And in that, what I want folks to think about is that in all of that feedback that you get, that you're going to need to be adaptable to change, and that's going to lead you to some true vulnerability. You can only be vulnerable and fully developed human being if you are all right with change and being adaptable to that change. You should not be the same person in this position a year from now. You should not be the same person in this position a year from now. Okay. So these are usually the challenges in pulling it all together for our professional residence hall staff. Added into this as well too is the challenge of working through COVID-19 and how that will be impacting us, not just for this semester, but I anticipate at least for the next year and a half or so. And on top of that, how we work towards creating a more just society, especially when it relates to dismantling white supremacy and making sure that we are not ourselves creating an environment of anti-Blackness. Those are the things that are folded into this as well too. All right. So their expectations, your CDs, we'll talk about some of this specifically, but these are just some general expectations around approachability, availability, awareness, commitment. What do these things look like for you? And then as you decide what you being a professional looks like, what does that mean for you in terms of how you are ethical around finances, romantic relationships, friendships, attendance, attires, appropriate communication, and how you're holding some level of integrity. And then the last thing I'm going to leave you with before I move on to talking about some of our approaches to COVID-19 right now is around good judgment. Because I think this is actually the biggest part of what we are trying to navigate. I'm going to try to give you some guidelines specifically, as specific as I can. But in all of this, we have hired you or rehired you because we think you have good judgment or the possibility of creating good judgment around situations. And that it will change from situation to situation as well too. All right. So that's going to bring me to COVID-19 stuff. I am looking to see if there are any questions. And Sarah, correct me if I'm wrong, but I do not think I see any. Is that correct?
Yeah, I don't see any questions in the chat at this time related. I'm looking to see if Quentin, do you have questions in your group?
No, I don't have any questions.
Okay. I just saw you get close to the screen, so I just wanted to make sure. Okay. Maple, Daniel, do you have a question?
I think I see something at Maple. All right, and I think what should pop up on the screen right now is the health and safety during COVID-19.
Yeah, that is what is showing up during the on the screen share. Looks like Maple, Daniel is writing in the chat, so give it a second. And Daniel's question is related to what is meant by dismantling white supremacy with racial biased housing policies.
Yep.
I think
1 second to look at the. Yeah, we actually do have a change in our drug policy, which is trying to balance out what that looks like along with what the federal government requires us to do. I think we're covering that on Wednesday or Thursday of next week.
Yeah, when we go over all of protocol.
Yeah, but I needed to find a balance between, okay, what can we do to basically lessen the presence of police in such a way that it makes folks feel unsafe, along with what we need to follow with federal guidelines as it relates to enforcing our drug policy. And I hope I found a balance to that. Basically, there is some fun federal law, even for most liberal universities around the country, especially those universities and states in which there's legalized marijuana to a certain degree, where they're still enforcing policy around drugs on campus. And so this is what I sort of had to do in addressing that. So you'll hear more about that, I think, on Wednesday and Thursday of next week. Thank you for the question, Daniel. All right. I'm going to keep us on time a little bit. I don't think I see any questions up for the screen. Trying to bring everyone those up.
Yeah, I don't see anything else, Tomás.
All right.
All right.
All right. So Danny shared earlier that, in his 40-something, 30-something year career, I might be adding more numbers to that than I thought, that he has not seen anything like this, that this is all strange and weird and unusual. And that is going to be the case for every single person that you talk to at this institution, that there has been nothing like this. Most of y'all aren't old enough to remember anything around 9/11. And maybe the only other sort of impactful things that might come close to that for some of y'all would be things like hurricanes that have struck Texas within the last couple of years. I'm particularly thinking around the Houston area, that even those things really haven't caused to any sort of degree what we're experiencing right now. So I'm gonna sort of try to walk us through what that means as we move forward. And really it is one step at a time. So as I'm prone to do, and I'm thinking that many of you were prone to do this as well too, as you started to think about coming back to campus, I went through all the articles that I thought made sense to go through, to think about COVID-19, what stuff is going to look like here at the institution from a societal perspective, what things are going to look like in the next year and a half or so. And there's still more and more things coming out that I continue to read and pick at and make changes, or am directed to make changes on at times for how we work here at the university. But essentially, what all of these articles and readings sort of say is that how we're going to get through COVID-19 depends. It all really depends. And I think everyone has seen that, not only from how each of our countries around the world have decided to respond to COVID-19, but also at smaller scales, how each state has decided to respond and how each of our communities have decided to respond at smaller levels. It's all going to depend. And the biggest variance to how it depends is, quite honestly, behaviors. What folks are doing individually is the biggest impact on how we move forward with COVID-19 as part of our everyday existence and lives. I will share with you that, you know, for a little while, oh God, was that about 3 weeks ago, I was at home for about 2 weeks because my kid, who turned 3 on the 4th of July, was exposed to COVID-19 by a teacher in his daycare. And now this week, he is at home because someone else was exposed at his daycare, and so they are taking the step of closing things down for at least a week. This is the reality that we are all trying to navigate through and to try to figure out what is the most appropriate step to move on. The way that we do that is going to be dependent on your behaviors. And again, I trust that the reason we hired you or rehired you is because we trust that the judgments that you're moving forward with are thoughtful, but I'm still going to try to provide some guidance on that. And behavior is what I want you to think about. So here's something for you to reflect on. Changing behavior is actually pretty easy. It's the maintaining it that is pretty hard. Has anybody, if you can raise your hands or wave around, has anybody ever tried to get into exercising for the first time or returning to exercising after having not done so before? Okay, I see a bunch of hands. Yeah. Yep. It's not that first time that is hard always, although there's sometimes some build up to that. It's not that second time. It's that third or fourth or fifth or sixth or seventh time. Josh is making a face saying, no, it's really that third time that's hard. That is difficult, the regularity of it. You know, it's why some of us have the apps for running that remind us every day, hey, you have to go do this, or hey, congratulations, you completed this for this week. It's not that changing the behavior is hard, it's the maintaining it over time that is. And that's kind of how our brains are built in many ways, is to come up with a pattern and to stick with it. That literally there is a physical neuron that is connected that goes this path to making a decision, and that when you decide to change your behavior, a new path is created. Well, guess what? That old path doesn't really go away. It's still there. And if you don't remind yourself about this new path that existed, then this old path is what you kind of go to automatically. So changing a behavior is easy. It's the maintaining it that's the hard part. But you have control of your own behaviors, and here are the behaviors that I need you to be responsible for. I really, really need you to be responsible for these behaviors if we are going to make it through this semester and through these next, especially I think through these next couple of weeks. So, and by looking on the screen, I think folks are going to be doing this, and we'll also have to make some adjustments. So, the first part is wearing a mask, okay? Unless you are by yourself in your own private space, for our staff, that really means in their offices if they have their own private offices. For y'all, that means in your room by yourself, because you all will have your own bedroom by yourself. That has been made clear as well too. You will not have roommates for this semester and probably into the year. I saw some hands go up and some claps, yay. That you need, that's really the only time you should be taking off your mask is within your own private space, okay? That I need you to maintain social distance even with your mask on, especially when you're in settings like this. And so as I tell you this and you look around the room, make sure you're doing that. All right, and I know the easiest and cheesiest way to figure this out is by spreading out your arms and making sure you're not touching the arm of somebody near you. That's roughly the distance that you need to be. So as I tell you this, and as you come back, especially from lunch, please figure that shit out, okay? Please figure that out. CDs, please help with that as well too. Washing your hands, I think within this first couple of months, I had chapped hands like no one's business. Anyone else have chapped hands within those first couple of months? Yeah. I'm gonna continue to have chapped hands even with as much lotion as there is, because I wanna make sure that even though I have a mask on, even though I'm maintaining social distance, even as I'm giving presentations like this, I catch myself just wanting to touch my face. So just make sure that you're washing your hands, because even with your mask, even with social distance, we need you to do that. And then the other part of this, which is part of your job, is reminding folks, telling others to do the same. Hey, I need you to put your mask on, please, before you come to this program. Hey, can you put your mask on before we talk in our room? Oh, hey, I need to come in to look at something. Can you put on your mask really quickly while we talk? I need you to do that, especially as we start to have residents come back. The best place for you to start practicing that as well too is with each other, right? So the behaviors part is, again, easy to a certain degree, but there's also got to be some motivation for doing all this, besides some of it being part of your job. And there's really sort of two things out there that some of the research has indicated is important to you and your peers, your fellow students, that will help create that change. And I hope this research resonates with you a little bit. So if you want a more normal spring semester, and if you want to keep your friends and your family safe, these are the behaviors that you need to do. It's not going to be a completely normal spring, but it can be a more normal spring if you do these things. And you can keep your friends and your family safe by doing these things. That is the language I need you to think about as well too with your residents. I think most residents and most students are going to be expecting that this will not be normal. At least the returning folks will expect that this will not be normal. The first years, this will be their first time experiencing this, so maybe they'll be cool to a certain degree. But I need you to think about this as the motivation for why we are having you do all these things: the mask, the social distance, washing your hands and telling others to do the same so that we can return to something more normal. Not completely normal, but more normal. That makes sense to folks? Can I get some head nods, thumbs ups? Yeah, okay, thank you. All right, let me just check my notes on that. Okay. So again, same thing. And there's a little bit of a language change in here. Remaining socially distanced even with your mask on. The reason that's important as well too is because of some of the guidelines the CDC has around what isolation and quarantine looks like. And I'm going to go through that at the end as well too. It's why we have you with your mask on right now, even though many of you are socially distanced. And I'm going to ask you that you fix that if you can within the next 20 minutes. And definitely for sure as you come back after lunch for what that looks like. So if you want a more normal spring semester, do these things. If you want to keep your friends and your family safe, do these things. That is the message I need y'all to share with each other and with your residents. So how are residents going to feel? How do you all feel based on research that's out there about this upcoming semester? Residents, and honestly by default, y'all, you want to know that others understand how hard this is. And I hope that we are trying our best to express that I think we do understand how hard it is. And that y'all and your residents want empathy. Y'all and your residents want empathy. I'm going to show a very brief clip about what that means, what empathy means versus what sympathy means. So I am going to bring up a video.
So what is empathy and why is it very different?
Give me 1 second, folks.
Fuels connection.
To do this. Can folks hear that?
It's really quiet. Yeah, I think that will help.
Better?
Much better.
Okay.
So what is empathy and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, I'm down. I know what it's like down here and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. At least you know you can get pregnant. I think my marriage is falling apart. at least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. Because the truth is, rarely can a response make something better. What makes something better is connection.
All right, I think we're back to the PowerPoint. So folks want empathy. They want to know that you are able to feel what it feels like to be down in that space, to acknowledge how hard it is, and to not silver line things, as Dr. Brene Brown expressed there. So I'm going to talk a little bit more about understanding what else our students kind of want and need from this semester, and also knowing that we may not be able to fix or address all these things as we start off the year. So I'm going to start with one part of the research that came out about this is that our students, I think especially this is our first year students, because they just came out of high school going through this kind of stuff, was they're not generally enthusiastic about online games and activities. It's something they've been doing. It's something that many of y'all have been doing for the last several months, and they're not looking forward to it. I think they understand it, but it's not going to be their go-to all the time. Okay. And at the same time, what they do want is, when possible, they want outdoor, socially distanced activities. And when we can start to provide some of these, because we have some limitations in the state government around this, they want to do movies, they want concerts, they want exercise classes. So when you're thinking about building community in some way, and as we navigate the state guidelines around no more than groups of 10 being outside, what are ways that we can manage these things? So for instance, maybe you all do watch a movie outside in groups less than 10 on your phones. Maybe someone is outside playing their violin and others are gathering around to hear that informally, not as a specific program necessarily. The rec center, I'm sure, is doing some of these outdoor exercise classes when possible, but thinking about mindful breathing, stretching, yoga, things like that outside, going for a walk, going for a run. These are the kinds of things that, when possible, we should be thinking about and doing with our residents, again, socially distanced, wearing masks, things like that. And some of these things we won't be able to do in quite the same mass quantities that we would like to do in the next couple of weeks, at least. But I want you to just sort of think about, okay, what do my residents want? They want to feel connected. And that's hard to do right now, but I think it's still possible. Some more kind of stuff that we want to make sure that we cover during training, that we want to make sure our residents understand when they start arriving to campus, that they have asked questions about. I'm sure the HAs especially can attest to this. They want to understand some specific guidelines around what quarantine means and what isolation means. We've worked for the last several weeks to kind of clarify that with our students that have had to go into isolation or quarantine. They want to know what the steps are. And I think we've reached a good place to be able to educate folks around that when they've been asked to go into quarantine or isolation. That being said, one of the biggest obstacles around that is around the concept of contact tracing. So if somebody tests positive for COVID-19, what we are doing here at the university is asking them some questions around, well, who have you been in contact with? And that can make folks feel shame that they did, that they are the cause of some harm by testing positive, and then because of how they are around people, have put folks into some sort of isolation or quarantine. And that's something we really need to sort of destigmatize as folks get to campus. It will happen. It is part of the behaviors that they engaged in, but it's not about who they are. All of us have done something or we have fucked up on something, but that should not be marking who we are for the rest of our lifetimes. We messed up on something, our behavior, but that is not the indicator of who we are ultimately. And that's the kind of thing we need to think about. And I know that our professionals are trying to think about as they reach out to folks to ask about contact tracing and to work towards our quarantine and isolation protocols. Residents are afraid that they might get kicked off campus, and that if they share contacts from being at a bar or a party underage, that they'll get in trouble. We are not kicking folks off campus if they have to quarantine or isolate. Gina mentioned earlier, we have, and we'll be using McConnell as a location for that, but we are not kicking folks off campus. Folks can choose to go off campus, and some folks have through the summer to isolate there instead. And that is their choice to do that. But if they don't have a place to go, if they don't want to go home, whatever home might look like for them, then we are going to host them here on campus. That is our commitment to our folks who live here on campus, is to provide them some place to live. They might be afraid to share contact information if it was about being at a bar or a party. I have talked to risk management, who's sort of in charge of this process. The only things that they're really concerned about is around the health and safety for people regarding COVID-19. The things they would need to report outside of COVID-19 would be kind of the intentional self-harm or the intentional harm of others, similar to things around suicide and violence or related to kind of sexual misconduct. But if somebody was at a party, they're under 21, they're drinking with other folks, we're not going to put them through the conduct process for that, because that kind of defeats the purpose of them coming forward with as much information as we need in order to keep folks healthy and safe in the long run. So that's something that folks might be afraid of, and we need to reassure them that our concern is around the health and safety as it relates to COVID-19. So again, this research that I'm talking about asked about mask, and generally speaking, folks don't seem to have a major problem about wearing masks in the areas that they're required to. So classrooms, university-related activities. There are concerns about wearing masks in locations like social settings. So like I mentioned, parties, get-togethers, etc. That goes back to that original language I shared with you all at the beginning of this around, if you want to have a more normal spring semester, here's what you need to do. If you want the semester to continue as best as it can, here's what you need to do. So that's the kind of stuff you should be able to share with your residents about how would you approach somebody who isn't wearing their mask at a social gathering of some sort. We know that that's still going to happen. And I'll have some other language for that in a second too. All right. So bottom line in all this, we need to show empathy. We need to be flexible about activities when allowed. We need to find ways for students to socialize, so not only relying on the online stuff, but also around face-to-face socially distant contact when possible. And then we need to be as specific as we can and also realistic. So for instance, one of the ways I'm trying to be realistic with y'all around this, especially as we get into curriculum stuff later this week, is that I am not expecting, nor do I hope for, mass numbers of people attending your online programs or in-person things as they're allowed. I am expecting quality of connection as best as possible. A lot of your curriculum, especially if you had a chance to go onto Canvas to kind of look at what is up there right now, it's continuing to be input right now, is not really meant to be in person. And in fact, except for one instance that I'll talk about later this week, you could go through the entire semester without having an in-person program. I'm absolutely all right with that. And by default, the ADs, the CDs are going to be absolutely all right with that as well too. So, seeing questions come in, and I might get to some of that stuff in a second. All right. All right, I will get to that question at the end if that's all right, Michael, okay? So what has changed for this semester? Part of this has happened over the summer as well too. Well, it's a lot that's changed. Okay, 1 second to close down this other window before we start hearing Brene Brown speak again. There we go. So from a custodial facilities perspective, all the common areas are cleaned twice daily, and that is weekends as well too. There's being a shift in their schedules that is starting soon, if it hasn't already, around custodial staff being present 7 days a week as opposed to 5. The one exception to that I want to share and be specific about is music practice rooms. I'll go into what that looks like a little bit later when I start talking about desk operations. All of the CDs measured out space, and the ADs in some cases measured out a lot of your gathering areas, a lot of the spaces that you're in right now, especially for social distancing. So they have a good record of what it means to be socially distant within the spaces that you're in, how many folks should be in those spaces, generally speaking. So for instance, Crumley, the folks who are over at Crumley right now, Joe Green, I think Sarah maybe did the initial measuring, or Amanda did, I can't remember who did anymore. And then the chairs and the tables, I set up in that way to sort of maintain that social distance. And where that can be done ahead of time when possible, great, please do that. I think in some locations you might even see little pieces of tape on the floor that might indicate, where chairs should be, things like that. But please check in with your CD so that they can go through about what that looks like. All the front desks have plexiglass at the front, so that there's a little bit more limited contact. There is going to be signage galore from the university, not just from Housing Res Life, but from the university, that is going up in all the residence halls, that is present in all the academic buildings, and to such a degree that they're even tracking about what was put up where. This is really a concentrated effort from the university. So see that signage. You'll see that signage up around things like wearing masks, social distance, wash your hands, all that sort of stuff. FAs, I think, are still in the middle of, if I remember correctly, moving or rearranging or moving out furniture in some cases to allow for social distance. So expect to see less furniture in some of your lobbies and lounges. All the front desks that had chairs usually at them, all those chairs removed. You're going to see that spreading out of furniture, I think probably all the way up through when we open the halls, because it has been such a large task for for the FA folks to take. So thank you, FAs, for working on that. And then our goal is to provide staff, that's all of y'all here, along with the part-time desk clerks when they start, 2 to 3 masks monthly, so that you can rotate them in and out. Not wear the same mask every day. You can wear one, clean it, wear another one the next day, clean it, switch off back to the other one. And so you should have received, I think, mask when you got here. And then you'll probably be receiving another load of mask sometime soon as well too. So that's our commitment around that, along with gloves and cleaning supplies at the front desk. If you discover that some of that stuff is running low, please let your CDs know. And then the CDs are communicating that centrally, because we have a stock of those supplies that our facilities and custodial folks are in charge of, to make sure that they're going out everywhere, as opposed to trying to order, you know, something off Amazon last minute or anything like that. In terms of our desk operations, no more than 1 person at the desk. No more than 1 person at the desk. Most of our desks do not have the space to allow for adequate social distancing. That includes then, as the RA on call, I'll name that specifically, that we will not have the RAs on call off the desk. All right, that makes sense? Okay. And then we've tried to limit as many cross-desk interactions as possible. What that means is that we no longer have cleaning supplies to check out, so there's no brooms, mops, or vacuums for residents to check out. All of the game table supplies have been left out at those game tables, and we're in the process of providing cleaning products so that those items can be wiped down for residents to use before they actually start playing with them. If there were kitchen supplies or games or puzzles for other things like that to be checked out, those are no longer being checked out either. Kitchen supplies, where appropriate, have been asked to be placed in the kitchen. And then games and puzzles, things like that, are just sort of being kept at the front desk until being told otherwise. But we're really limiting any sort of interaction at the desk. Basically, here's a key if you're locked out or you're checking in for the first time, and random questions that folks may have. The desk really is not meant as the hangout space anymore. And so for some places where that has felt like the case, that really shouldn't be happening anymore. So trying to cut that back down as much as possible. Part of that I named a little bit earlier was the music rooms. Even for the music rooms, there's now going to be an online process for reserving rooms. Bruce, you're the biggest complication in music rooms, because I think you probably have about a dozen or so. Other places you have 1 or 2, but basically music rooms can be reserved online. There's an hour break in between each reservation, and that is the only common space that cannot be cleaned with regularity because of the potential use that will occur by residents. So it's up to residents for those music room spaces to wipe down things on their own. And that's a message that needs to be passed along in all those places in which there is music room use, and be part of the signage, part of the online sign-up process as well too. RamFam, I'll get to that question at the end of this slide. The residential curriculum, I'll go into specifics later this week. It's a condensed schedule and format. So basically anything that was active ends right before Thanksgiving, because as you all know, around Thanksgiving, there'll be no more in-person classes. So it doesn't make sense for us to require anything active, except for a meeting to talk about winter closing at that point. Any sort of active programs are kind of kaput at Thanksgiving. Expect that most of your programs are going to be online, at least for the first part of this semester. They can be hybrid and they can be in person, but in person is going to be pretty limited. I'll talk about what that means a little bit later this week. Your online meetings, you should expect to have a bunch of those. That's going to be your one-on-ones with your CDs or ACDs. That's going to be some of your wing meetings, and I'll talk about that later this week. And that's going to be your staff meetings. Most of those things are going to be done through Teams or Zoom. Most likely Teams for most of your stuff. And then in terms of visitors, what has been the case for this summer as well too, and for at least the first couple of weeks after move-in, is that there will be no visitors. What that looks like, what that means is that folks are more than welcome to interact with folks within the same residence hall. But from folks outside of that residence hall, that should really be done somewhere else, not within the building. That makes sense to folks? Now I can talk about that a little bit later this week too, when I go over the curriculum and when I go over what that first week meeting looks like. Okay. And then our safety stuff that we usually do. I know everyone loves doing those monthly drills that are returning. So our fire and tornado drills, I'm basically working on an online quiz version of those. Expect that sometime end of this week or early next week, I will probably be asking a couple of the residence halls to set off their fire and tornado drills and record those sounds so that I can include this as part of the online quiz that our residents will be required to take. We're not going to be doing actual physical tornado or fire drills. There's no way that I feel safe or comfortable with y'all and the residents being able to maintain social distance as you're going down the stairs for just practice. The real thing happens, we will have to work through that if it happens, but for practice, I do not think it's worth us trying to do that and maintain social distance. So there's going to be an online version so that your residents know what the difference is between a fire drill and a tornado drill, what they sound like, and where they should go for those things. Safety inspections, the monthly safety checks that folks do, especially into the residence rooms, those are essentially on hold until at least Thanksgiving. So those RAs for y'all keying in to look at resident rooms, to look for things, expect that that's not going to be the case until Thanksgiving. That doesn't mean, I see you dancing up front, Kerr. That doesn't mean that you still won't need to enforce things as you see things in rooms, but we're not going to try to put you intentionally into those rooms to go and look and expect for things. So just know that that's going to be the case. There may be some substitute for that, again, something like an online quiz for our residents to do, but nothing physical until at least Thanksgiving. And then finally, the isolation, the quarantine protocols, and that's where I'll get to Michael's question. We have practice around that, unfortunately, for what that looks like. We've had that with residents. We've had that for staff who've been affected. And I feel better now about where we are, especially having basically a coordinator for that process working in McConnell as the contact person for all of that. And I can explain very briefly what that looks like. Basically, if a contact tracer reaches out to somebody because they were somebody exposed to someone who tested positive for COVID-19, that person will have to go into quarantine over at McConnell. They'll be asked to bring whatever they need for basically about the next 2 weeks afterwards. There'll be some assistance for that via moving carts. Again, our coordinator for that will help with some of that. And then folks will be fed regularly for that time period with meals brought to doors. Stuff that can be eaten fresh, and then some stuff that can be reheated via microwaves and refrigerators that are being provided in all of those spaces in the rooms. And that does mean for everybody, not just for residents, but for RLAs who may test positive or been exposed to somebody who tested positive for COVID-19. That has also been the case for our full-time staff as well too, that they've had to self-isolate within spaces so that they don't come in contact with anybody. The other question, packages, thank you, RamFam, for bringing that up. Those are still being handled at the front desk. What I would ask folks to at each of the front desks to do is to find a way to confirm that person's identity, and that for me, a signature is not required. But we need to know that it is the right person picking up those packages in some capacity. So confirming their ID, making sure there is multiple ways to say that this is the person, and that you, if you are working behind the front desk to do that, are doing everything you can to make sure that that's recorded somewhere. Okay. All right. And I see another question from Joe Green. How are we going to hold students accountable when things get broken, go missing, or left messy if we aren't checking things out? Kitchen is an example. Excuse me. We are going to leave things in the kitchen for as long as they work. If something breaks, then we are not going to have that item in the kitchen anymore, which then really will limit and is more important to the residents that they take care of those items. If we really need to get to a place in which a kitchen is being left messy by residents, I would much rather prefer that we hold some sort of community meeting about that before we go to the step of closing off a kitchen. Okay. Going to closing off a kitchen feels a little too punitive for me automatically without not having first some sort of community meeting about it. Obviously, that would be something that we would have to do online, but I'd much rather prefer that we do that. And we need to make sure that residents understand that when something is broken or if something is messy, then that creates the risk of the kitchen not being usable by anybody. So please clean up your own stuff so that you don't create a mess for everyone else afterwards. I'm going to move on to the next slide. And this part is important around CDC guidelines. It is especially important because this is what is generally being followed to decide who is quarantined, who goes into isolation. And it's why I brought up mask wearing, social distance as many times as I have and will continue to do throughout the next 2 weeks and further. So who needs to quarantine? Anyone in close contact with someone who has COVID-19. This includes people who may have previously had COVID-19 and people who've taken the antibody test and have antibodies to the virus. So if anybody already had COVID-19 and you were exposed to somebody with it, they're still going to quarantine you. Okay. But what counts as close contact, Tomás? Great question. You are within 6 feet of someone who has COVID-19 for at least 15 minutes, mask or not. You're within at least 6 feet of someone who has COVID-19 for at least 15 minutes, mask or not. I fully expect that when we have somebody who tests positive for COVID-19, then more likely than not, their roommate or their suite mates will have to go into quarantine as well too. We are expecting that. But I don't want you to put yourself in a place where, especially since you don't have roommates, that this happens as well too. This is probably not the case for most of y'all, hopefully. You provided care at home to someone who's sick with COVID-19. That might be the case for some of the professional staff on campus though. Okay. This is a big one. You had direct physical contact with somebody who tested positive. You touched them, you hugged them, you kissed them. So If your boo tests positive, you touch them, you hug them, you kiss them, then expect to be put in quarantine as well too. That will probably be the case with residents as well too, and their boos. Expect that. And maybe not boos, but short-term hookups might be the other case. Okay. And then you shared eating or drinking utensils. So this one's important as we think about what programming is going to look like, is that your programs, even as we allow them to have and to be in person, are more likely than not going to include the usual pizza and wings, or the giant tray of pasta, or the fajita bar, or anything like that, because those are all shared utensils that are being used in some way to serve other folks. So expect things like snack packs, stuff from dining that they're trying to prepare for y'all's programs as well too ahead of time. Individual meals that can just be given over to the person and that they don't have to use any sort of utensils to serve themselves, or even as best as possible for you not to have to serve them as well either. And then this one, they sneezed, coughed, or somehow got respiratory droplets on you. I'm not sure of other ways that they got respiratory droplets on you besides sneezing or coughing. But again, that's also what counts as close contact. All right, I see some questions. I'm going to get to those in a sec. I'm going to scroll up so I can see all of them. Give me 1 second.
You want me to read those out, Tomás?
No, I've got them.
Okay.
Or yeah, if you want to read them out, you can start with Victory.
Yeah. So if we are or students are contacted by a contact tracer, are we automatically sent into isolation for 2 weeks, or can we be tested to see if we test negative? Are there testing sites on campus?
So generally what I've seen is that folks are almost automatically sent home for 2 weeks, even with a negative test, in part because what there's concern about is how long it takes for those symptoms to show up.
Yes.
And if the tests are also taking 3 to 4 days to come back, then within those 3 to 4 days, symptoms may show up or not, which is the other part of this that is difficult for us to navigate. There is testing available through the Student Health Center. So I'm combining 1 or 2 questions here. I know that we are working with meaning Housing and Res Life is working with them around what testing would look like for y'all. Some folks were actually already contacted ahead of time so that we could have a sense of what y'all coming back to campus looked like. And that seems to have been going well. I'm trying to look and working with Gina around something bigger, AKA if we have the possibility of getting everyone tested either now or at some point later, then we want to do that for y'all, okay? I don't think we're worried about the finances for that. I think we're more worried about the logistics and then the number of tests that the Student Health Center has available. That's more of the logistic that is slowing us down, especially as folks come back to campus. So I'll hopefully know more about that over the next week or so.
The next question is, if one person in an in-person class has it, the entire class has to quarantine, question mark.
I would assume that could be the case, especially if they are within less than 6 feet of each other, or if somehow there's the sneezing, coughing, or respiratory droplets got on other folks in the class. I can see that very likely being the case, but I don't know if it's a guarantee, to be honest. The contact tracers, and I think some of our I think all of our assistant directors who went through the contact tracing program would probably have better answers around that. So I'm going to look at them very briefly to see.
So I'll answer that. So I just finished my training. It depends on in the class who sits next to each other. There's a list of questions that as a contact tracer you have to ask, and that'll determine, because Tomás and Sarah could be in the same class, but if Tomás might be, you know, based on where Tomás sits, it might not be close enough to Sarah for us to determine that that is someone that would need to be contacted. And if it is iffy, we contact, basically, is what I've learned through the training is if you're unsure, it's better to err on the side of caution and let them inform them so that they can quarantine.
The next question you already answered about the testing for residents or indoor staff members being available at the Health and Wellness Center. And the next one is, if you are in a private occupancy room with a shared restroom and common area with a roommate, will you be transferred to a quarantine room or remain with them for 2 weeks in quarantine? So I think you answered that as well, but if you want to.
Yeah, I think I would provide the same answer. You would still go to quarantine.
At least one Texas university is sending its students COVID tests. Could you explain the decision to not test everyone who returned for RLT?
Resources is the easiest answer, I can tell you that, and access to money for that. Again, I think for y'all, I think it's going to be more about the logistics of doing that through the Student Health Center to see if they have enough of the supplies to do that. I feel comfortable if there's a cost to it that we can do that, honestly, at least with our department. We're an auxiliary service, so we have a little bit more, what's the word I'm looking for? Flexibility with our monies at times. That's not necessarily the case for every department on campus and for the university as a whole. We in many ways help to provide the resources for some departments on a campus to even exist.
The next question is, will we be given hazard pay to help pay for things like the tests?
I think that's where we're sort of hoping if we can just cover the cost of anything for that test that we would do so. That being said as well too, if any folks on our staff, our student staff, do you have to quarantine or isolate? I don't anticipate there's a change in pay, at least for the RA positions. For the FA, HA positions, there's a little bit of wonkiness there because that is what I would call more of a true hourly position. I think we've been able to work with that in the past. I expect we're going to continue to do that in the fall semester as well too.
The clarification on a question above, would we be quarantined with our roommates in our shared living space? No. Or be forced to move, be told to move to quarantine housing? Yes.
Yeah, you need to move to quarantine housing.
So
and the reason for that, you know, let's say your roommate tests positive, but you don't. We don't want you to have, we don't want you to be with your roommate in case you haven't caught it, because there is absolutely no way to guarantee that you wouldn't get sick by simply staying with your roommate. I hope that makes sense. We want to put you in your own room with your own bathroom, not some sort of shared living space.
How are RAs going to enforce the new visitation policies?
Yep, and I see that too. That's
Okay.
two questions on that, yeah. The first way is, quite honestly, our residence halls are going to be locked down pretty tightly insofar as card access. There'll be some stuff we have to navigate around that with places like West and Kerr with the dining halls, but those spaces aren't actually too different from where residents can enter in terms of the card swipe stuff. A lot of this is going to be about y'all saying things ahead of time to your residents so that they understand, by that being said at the wing meetings that y'all will have as we kick off the semester, that this communication is not also just coming from y'all, it's coming from other folks around the university. So that is going to be the way. And then, quite honestly, if we need to enforce it from a documentation perspective, I'm more than happy to support y'all in writing those incident reports, and if need be, to take it through some sort of process. I don't want to do that because that really doesn't help to create community. I know many folks are here in order to feel like they are part of a community, to meet other folks, all that, but we can't operate like that. for these first couple of weeks. As we do more testing, as we go through the semester, we can change that. But in order for us to have a semester, in order for us to have a more normal spring semester, these are the things that we're going to have to ask folks to do. Would residents who live together quarantine together if they came in contact? I'm assuming you mean in the same room, RamFam? I'm going to look for a head nod for that.
Yes, it looks like they are thumbs upping.
They would still be moved to the quarantine space that we have on campus. They would have their own bedroom, their own bathroom. So they wouldn't be quarantined together, if that's what you mean, in that same way.
So it is 11:59, Tomás,
Okay.
and
Yeah.
we do have lunch on a pretty strict schedule.
Yep.
What I want to do, if it's okay, is get these questions from the CDs. So CDs, please collect these questions. We want to answer them and provide all of the clarification. I know there's, a lot of questions surrounding these things. So.
And here's the one thing I need to share before folks go. So there is a hotline here at the university, the COVID hotline. It is there for folks to call if there is any sort of report of folks with COVID-19 symptoms, yourself, and if need be others, so that we can give them the assistance and the help that they need. This is the hotline call for anything COVID related, but especially if there's anything around symptoms, testing results, things like that. And then this is where everything is sort of centralized. There's the phone number below. Excuse me, I'm going to bring it up back on the screen in a sec. And then there's the email, covid@unt.edu. What I need folks, again, to remember are these things. A more normal spring semester by following this stuff. And then that bottom line again, around being flexible, show empathy, find ways for students to interact socially. Again, following all of our guidelines, and be as specific and realistic as you can. But this, the COVID hotline, I'm leaving this up there so that folks have the number, folks have the email, and that it is the central place for folks to go to with questions. And so Sarah is going to collect all the questions so we can answer some of them. And I'm going to thank you again for your time. I will see some of you at lunch in a little bit. And thank you again. Thank you for being here. Thank you for being patient. I know that we are going to work through this together. We're gonna mess up somewhere, but I trust our ability as a whole group to navigate through that and support each other through that as well too. So thank you again for being here.
All right, I've got Victory Squad. I've got your questions written down already. So I'll go ahead and throw those into the questions that we'll just answer from the CDs. So don't worry, your questions won't be forgotten. If any other questions show up in the chat, I will collect those as well. But at this point, if you have any questions, please pass those along. So while we are on a strict schedule for meal times, you still have an hour that you are not in meal times. So feel free to use that time, obviously to take a break, but also pass up your questions, and then we'll collect those and answer those as we are able. So, and if you are supposed to be going to eat now you should go. Thank you. Appreciate it.